Welcome to this module on building trust, collaborative relationships, and credibility in professional nursing leadership. These three elements are essential to leading teams, fostering interprofessional collaboration, and advancing meaningful change in healthcare settings. This module is designed to give you practical strategies you can apply immediately, along with theoretical frameworks to deepen your understanding. As a nurse leader, how you communicate directly impacts your ability to influence others, lead through change, and create inclusive environments. Throughout this module, we'll explore strategies that help you connect authentically, build rapport, and gain trust from various stakeholders. From team dynamics to systems level change, leadership is rooted in relationships. We'll look at how credibility is earned over time, how trust is maintained, and how dialogue can be both therapeutic and empowering. By the end, you'll walk away with tools to lead conversations that matter, even when they're difficult. Let's dive in and explore how leadership is, at its core, about relationships. This module focuses on developing the relationship management techniques necessary for effective leadership communication. In today's complex and often high-pressure healthcare environments, it's not enough to simply deliver instructions or coordinate tasks. Leaders must engage others in ways that foster psychological safety, build credibility, and encourage shared ownership of goals. As you work through this module, you'll examine how inclusive, diverse, and innovative discussions promote collaboration and help resolve challenges. We'll look at how strong communication practices are essential for fostering team cohesion and navigating difficult situations. You'll learn how to manage the interpersonal dynamics that come with leadership roles, especially across disciplines. Importantly, this module bridges theory with practice. So what you learn here, you can use right away. Expect to explore real-world examples, case studies, and proven communication models. Our goal is to help you lead more confidently, compassionately, and credibly. By the end of this module, you'll be equipped with a comprehensive toolkit of strategies to build trust, credibility, and collaborative relationships. First, you'll learn to critically evaluate and apply trust-building strategies that are evidence-based and applicable to real healthcare environments. This means moving beyond general communication skills to strategies that build lasting influence. Second, you'll explore and apply communication techniques that establish professional credibility and foster teamwork across disciplines. You'll practice how to speak with clarity, purpose, and authenticity, even in challenging conversations. Third, you'll learn to use empathy-driven responses to defuse tension and promote understanding. Conflict and emotional dynamics are inevitable in healthcare, and responding empathetically is a leadership skill, not a soft skill. These outcomes are designed to be both measurable and transformative. They'll prepare you for the interpersonal demands of nursing leadership and help you navigate your teams through complexity with confidence. In this module, we'll explore 5 interconnected areas of relationship management. These include trust and credibility, inclusive dialogue, stakeholder relationships, addressing complex topics, and conflict engagement. Each of these dimensions is critical in today's healthcare environments, where communication errors can impact outcomes. Trust and credibility form the foundation. You'll learn how to communicate in ways that inspire confidence and reliability. Inclusive dialogue is about ensuring all voices are heard and valued, especially in diverse teams. We'll explore therapeutic communication techniques that create safe and respectful spaces. Stakeholder relationships require an understanding of how to engage across different levels, from direct care teams to community partnerships. When it comes to complex topics, you'll learn how to lead conversations around challenging issues like equity, safety, and system reform. Finally, we'll cover strategies for engaging in conflict in ways that strengthen, not fracture, relationships. Together, these areas form a roadmap for effective, authentic leadership. Trust and credibility are the cornerstones of effective nursing leadership. Without trust, even the most skilled leader struggles to create buy-in or inspire action. Research shows that trust improves patient outcomes, increases job satisfaction, and reduces staff turnover. As a leader, your communication style can either build or erode this trust. Ethical communication means being transparent, maintaining confidentiality, and following through on commitments. It also means being honest about your own limitations and being willing to admit when you're wrong. Consistency is equally important. Your team needs to know what to expect from you. When your actions align with your words, you create psychological safety. However, trust is fragile. One broken commitment, or a moment of perceived dishonesty can undo months of rapport. That's why deliberate, values-based communication is essential to building credibility and sustaining team cohesion. Credibility isn't something that comes with a job title. It's earned through your behavior. Accountability is one of the most visible markers of credibility. When leaders take responsibility for their actions, acknowledge mistakes, and actively seek feedback, it signals integrity. There are 3 levels of accountability that matter here: personal, organizational, and team. At the personal level, you show up by modeling transparency, learning from failures, and staying consistent. Organizational accountability means advocating for resources, being honest about system constraints, and supporting your team even when it's uncomfortable. Team-level accountability involves setting clear expectations, recognizing contributions, and addressing concerns fairly. All 3 layers work together to form a culture of mutual trust. Research shows that leaders who embrace accountability drive higher staff engagement and are more successful in implementing quality improvement efforts. In short, credibility grows when you own your role and lead by example. Let's take a look at a real-world example of trust being rebuilt after a major safety event. In this case, a medication error impacted a patient, and instead of focusing on blame, the nurse leader applied a just culture approach. She prioritized transparency, involving staff in the review process and solution building. Her open communication and refusal to scapegoat set the tone for a culture of safety rather than fear. Staff felt empowered because their insights were valued, and the team collaborated on new protocols that addressed system-level weaknesses. This approach demonstrated accountability at every level: personal, organizational, and team. The leader didn't just say she valued patient safety, her actions proved it. Importantly, her response aligned with the team's core values, which helped rebuild credibility and morale. This case is a powerful reminder that how you respond to adversity defines your leadership more than how you perform during routine operations. Inclusive dialogue is essential in healthcare because it ensures that every team member's voice is respected and valued. When leaders foster inclusivity, they create environments where ideas flourish, concerns are raised safely, and patient care improves. Therapeutic communication techniques, like reflective listening and validation, help build rapport and create emotional safety. These skills, borrowed from mental health nursing, support healing interactions within teams. Culturally responsive communication is also critical, as it helps leaders navigate differences in language, decision-making preferences, and power dynamics. Psychological safety grows when staff feel heard, respected, and supported without fear of judgment or retribution. As a leader, modeling caring behaviors, like being present, acknowledging emotions, and affirming contributions, builds stronger, more connected teams. Inclusion and care aren't just soft skills, they're leadership tools that promote engagement and collaboration. When used consistently, they transform ordinary team meetings into meaningful, inclusive discussions that move practice forward. Now let's explore some practical strategies for creating inclusive and therapeutic dialogue. Start by amplifying quiet voices. Create space for those who may not typically speak up by using round-robin techniques or written input. Rotate leadership roles in meetings to share power and promote diverse leadership styles. Address microaggressions directly and proactively. They undermine inclusion and erode trust. Use mindful presence. Eliminate distractions and offer your full attention during conversations. Reflective listening helps validate people's experiences and ensures mutual understanding. Appreciative inquiry shifts focus to strengths and possibilities, which is especially useful in team planning and conflict resolution. Validation acknowledges others' feelings even if you disagree. This builds respect and openness. Trauma-informed communication and solution-focused questions are essential tools for sensitive discussions. When you apply these strategies intentionally, you build stronger, more resilient teams that feel seen, valued, and empowered. Effective nursing leaders build relationships at every level of the healthcare system, and each level demands a tailored approach. At the individual level, mentoring and coaching help build trust one-on-one. Team-level work requires facilitating collaboration, addressing conflict, and promoting shared ownership of goals. At the organizational level, leaders navigate systems and advocate for nursing perspectives in decision-making spaces. At the system level, you may engage with policy, professional organizations, and regulatory bodies to influence broader healthcare trends. Community-level leadership means partnering with organizations and advocacy groups to support public health and social determinants of health. Each layer adds complexity, but also opportunity. The key is to adapt your communication style while staying rooted in authenticity and core nursing values. Successful nurse leaders know how to flex their approach while maintaining credibility and connection. Influence is one of the most powerful leadership tools, and when used ethically, it drives positive change. Cialdini's 6 principles of influence give us a framework to apply in nursing leadership. Reciprocity encourages collaboration by offering genuine help before asking for buy-in. Commitment and consistency help you build momentum by starting with small agreements that align with shared values. Social proof is about sharing successful examples from peers to build support for change. Authority comes not from your title, but from your expertise and credibility. Backing up proposals with data and clinical insight builds respect. Liking reminds us that people are more likely to follow those they feel connected to. Relationships matter. Scarcity can be used to emphasize urgency or unique opportunities in quality initiatives. These principles, when grounded in integrity, help you lead persuasively without manipulation. Consensus building is more than compromise. It's about finding win-win solutions that reflect shared priorities. In healthcare, this often starts by connecting proposals to values like patient-centered care, safety, or professional development. When we separate people from problems, we make space for both emotion and rational problem solving. Focusing on interests, asking why someone holds a certain position, helps uncover what truly matters to them. Generating multiple options before choosing one allows creativity and inclusivity in decision making. Using evidence-based criteria helps teams evaluate options without bias or emotion clouding judgment. Identifying your BATNA, your best alternative to a negotiated agreement, helps clarify limits while encouraging realistic planning. These strategies are especially helpful when multiple stakeholders with different goals are at the table. Leaders who build consensus effectively often unify teams behind shared visions rather than divisive positions. Nurse leaders are increasingly called to lead conversations about topics that are difficult, emotional, or deeply rooted in values, like health equity, social determinants, or major system reform. These discussions require more than good intentions. They need preparation, emotional intelligence, and skillful facilitation. When leading these talks, start by setting clear ground rules to promote respectful engagement. Acknowledge existing power dynamics between professions, roles, or communities, and make space for all voices. Stay focused on actionable change while honoring the complexity of the issues. Health equity dialogues, for example, must center historical and lived experiences without minimizing current realities. Conversations about social determinants require broad, systems-level thinking that reaches beyond traditional clinical roles. Organizational transformation efforts benefit from a balance between big-picture vision and practical implementation steps. These topics aren't easy, but when approached thoughtfully, they can become catalysts for real change. How you frame a conversation can shape the entire outcome. Research shows that healthcare professionals are more engaged when discussions are framed around values like justice, compassion, and excellence. This is called values-based framing, and it helps root complex topics in shared purpose. Solution-focused framing is about emphasizing what can be improved rather than dwelling solely on the problems. When people feel hopeful and capable, they're more willing to act. Taking a systems perspective reduces defensiveness by focusing on broader issues rather than individual blame. Finally, patient-centered framing aligns everyone, no matter their discipline, around a common goal: better outcomes for patients. These 4 strategies, values, solutions, systems, and patience, form a powerful toolkit for engaging others in tough conversations. They keep the dialogue constructive, hopeful, and purpose-driven. Purpose-driven discussions are structured to generate engagement, meaning, and concrete outcomes. They connect difficult or complex topics back to the core mission of healthcare: healing, advocacy, and service. One powerful method is appreciative inquiry, which begins with what's working and uses that strength to inspire innovation. The World Cafe method brings people together in rotating small groups to explore key questions and build collective understanding. Nominal group technique balances solo thinking and group discussion to create consensus on priorities. Liberating structures are a collection of small, flexible discussion formats that engage everyone, not just the loudest voices in the room. These tools are adaptable to your leadership context, whether you're facilitating a team huddle or leading strategic planning. Purpose-driven dialogue also requires balance. space for emotion, and space for strategy. The goal is progress, not perfection. Conflict is not a sign of failure. It's a natural part of diverse teams working together. When leaders see conflict as opportunity, they can uncover hidden concerns, foster innovation, and build stronger relationships. But not all conflicts are created equal, and not all require the same approach. The Thomas Kilmann Conflict Mode Framework helps leaders choose the right response, from competing in urgent safety issues to collaborating on complex team disagreements. Avoiding might be useful short-term, accommodating preserves harmony in less critical matters. Collaborating, though, is the gold standard for complex issues needing long-term solutions. Reframing conflict as a shared challenge rather than a personal attack builds psychological safety. And most importantly, empathy is your anchor, acknowledging emotions while still moving toward resolution. Conflict isn't the end of trust. It's often the beginning of deeper understanding. When conflicts escalate, leaders must rely on advanced communication techniques to keep conversations safe and productive. One essential skill is de-escalation, calming the emotional temperature of a situation without silencing the message. Start by regulating your own emotions and staying grounded. Your calm presence will influence the tone. Use neutral body language, open posture, and consistent eye contact to communicate openness. Acknowledge the emotions in the room, even when you don't agree with the content of someone's statement. Slowing the pace of speech and offering thoughtful pauses can reduce reactivity, redirecting attention to the discussion process, how we're talking, instead of content can help reestablish control. Offer choices where appropriate to give people agency in how to proceed. Structured approaches like interest-based problem solving and the Crucial Conversations model offer frameworks for high-stakes dialogue. These strategies equip leaders to navigate disagreement with clarity, respect, and effectiveness. Some conflicts go beyond logistics. They involve values, identity, and emotion. These require a deeper level of listening and engagement. Deep listening means being fully present and setting aside your own mental chatter to really hear what's being said. Perspective taking helps you understand the motivations and reasoning behind someone's viewpoint, even if you disagree. Emotional recognition goes a long way. When people feel their emotions are acknowledged, they become more open to conversation. Reflective responses combine summarizing content with naming emotions, which builds trust and confirms you're listening. Clarifying values helps surface shared beliefs beneath the disagreement. This often uncovers common ground. These empathy-driven techniques are especially powerful in healthcare, where end-of-life care, resource allocation, and ethical dilemmas are frequent. Leaders who consistently apply these tools create space for both emotion and progress. They demonstrate that empathy and leadership are not opposites. They're partners in effective communication. One of the most advanced leadership skills is learning how to balance assertiveness with compassion. Assertiveness is about speaking up clearly and directly about your needs, values, and concerns. Compassion, on the other hand, involves tuning into others' feelings, perspectives, and needs. Leaning too far into either side, being too rigid or too accommodating, can hurt relationships and effectiveness. The goal is dynamic balance, choosing the right tone, timing, and content for each situation. Use I statements to express yourself without assigning blame, and focus on impact rather than intention. Strategic timing helps. Some conversations are better had when emotions have settled or when trust is stronger. Principled focus means staying anchored to your values even when there's pushback, while still being open to new approaches. Relational awareness reminds us that how we communicate matters as much as what we say. Leaders who can balance these two forces, assertiveness and compassion, build credibility while maintaining meaningful relationships. Let's review the key takeaways from this module. First, trust is built through consistent actions, ethical communication, and accountability at all levels, personal, team, and organizational. Second, inclusive dialogue is vital. It creates environments where people feel heard, respected, and safe to speak up. Third, stakeholder engagement requires tailoring your communication style to the audience while staying grounded in your values. Fourth, complex conversations about equity, change, and systems transformation benefit from framing that centers values, solutions, and shared purpose. Fifth, conflict is an opportunity, not a threat, when managed with empathy, structure, and curiosity. Leadership isn't about avoiding hard conversations. It's about showing up with the skills to navigate them thoughtfully. These strategies aren't just tools. They're habits that develop over time with reflection and practice. As a nurse leader, your communication choices have the power to transform teams, shape culture, and improve care. Keep these principles close as you grow into your leadership voice.